How long do second-generation antipsychotics take to work? If you or someone you care about is considering second-generation antipsychotic medications for schizophrenia treatment, you might be wondering how long it takes for these medications to start working. Let's break it down step by step to give you a clear picture. First, let's talk about the initial onset of effects. Research shows that some improvement in symptoms can be noticed as early as the first week of treatment. Medications like risperidone, olanzapine, quetiapine, and asenapine can start to show positive changes within this timeframe. Many patients report a significant reduction in psychotic symptoms during the first 1 to 2 weeks after starting these medications. Next, most individuals typically experience a more noticeable reduction in positive symptoms, such as hallucinations and delusions, within 2 to 4 weeks. The most significant symptom relief often occurs during the first 2 weeks, but there is usually continued improvement over the next several weeks. Now, let's discuss the time it takes to reach maximum effect. This often takes longer, generally between 4 to 8 weeks. Clinical guidelines suggest maintaining treatment for at least this duration at an optimal dose before considering any changes, unless side effects or other concerns arise. It is also important to note that response times can vary greatly from person to person. Factors such as the specific antipsychotic used, dosage, and the severity of the illness can all influence how quickly someone may notice benefits. Some individuals may respond sooner, while others may take longer. Second-generation antipsychotics primarily target positive symptoms by affecting dopamine and serotonin systems in the brain. However, they may have limited or variable effects on negative symptoms, like social withdrawal or lack of motivation. This can impact how quickly overall improvement is perceived. For those undergoing treatment, it is essential to understand that while some relief can happen quickly, full benefits often take several weeks. Regular check-ins with healthcare providers are vital to assess how well the treatment is working and to manage any side effects. Patience and sticking to the prescribed treatment plan are key for achieving the best outcomes in managing schizophrenia symptoms. In summary, second-generation antipsychotics usually begin to work within the first week, with noticeable improvement commonly seen by 2 to 4 weeks, and maximum effects typically reached by 4 to 8 weeks of consistent treatment. This timeline can help guide expectations and decisions regarding schizophrenia treatment.